we are going to go in and have a consult.
Let's definitely do it.
But I definitely want to check this out. I'm really proud when we talk on our first initial call that I am able to tell them not only is Doc, plastic surgeon board certified, but he's also an ENT. But come this way with me.
Oh, we're doing this, huh?
We're doing this. Doc, I want you to talk about the wall.
Okay, well, these are just simply the diplomas. And so my original medical training, University of Colorado for School of Medicine, graduated 1996. After medical school, of course, you do residency. So I did my first residency in ENT. In fact, as I alluded to earlier, it's really because of rhinoplasty that I made that call to Mom. Mom, I know what I'm doing. I'm going to be an ENT doc. And she said, yeah, of course. Well, of course, that is what I ended up doing. And that's a 5-year residency. So I did that residency here also at the University of Colorado. So 9 years of medical training here in Colorado. It's a big benefit to me because I know many of the doctors in town, ENTs and plastic surgeons. It's a great group of doctors, and I have a lot of familiarity with the hospitals and the doctors in town. So that led to board eligibility and ultimately passing board examination in ENT, so I'm board certified as an ENT surgeon. We did a lot of rhinoplasty surgery, sinus surgery, reconstructive surgery of the nose. That was really my passion in my ENT training. And then later went on and did go ahead and become board certified. Probably didn't have to, because I did go on and do a second residency in plastic surgery, another full residency based on plastic reconstructive surgery of the head and neck. So overlapped a lot with ENT, but also of the rest of the body. So breast surgery, a lot of breast reconstructive surgery, big part of my training, as well as working with a world-renowned facial surgeon who developed the endoscopic forehead lift and did a lot of nasal surgery there, as well as facial surgery. So in both residencies, working with a lot of different physicians in different environments, different hospitals on both reconstructive, functional, and cosmetic aesthetic rhinoplasty. So that's my training and background. And I don't think you have to be an ENT surgeon to be a good surgeon for aesthetic rhinoplasty. You don't have to be a plastic surgeon to be a good surgeon. And just because you even have both of these specialties in your background doesn't mean you're going to be a great surgeon. It will depend. In fact, Sierra was asking me earlier, someone does your breast aug surgery. Are they qualified to do your nose surgery? And the answer is totally depends. They may be very well qualified, but rhinoplasty is a specialty, I think, that you really want to look into their specific expertise of your surgeon for rhinoplasty procedures. Yeah. Okay.
Awesome.
We headed back?
Absolutely. 4, 5, 6, 7. Come on, wait a second. You're not done here. I want you to talk about these.
Okay, so after residency, so 7 years of residency, 2 full residency programs that I did, so chief resident in ENT, then later chief resident in plastic surgery. After that, you go out and practice in surgery before you get invited to take your board examinations, which is both oral and written examination, a rigorous and stressful process. And so I did that for both ENT surgery and board certified, and have maintained recertified in ENT surgery. Actually, my ENT or otolaryngology certificates over there, and then same with plastic surgery. I was invited to sit for my written board exam, passed that, and then invited to sit for oral board examination, defended my cases, and now I'm board certified in plastic surgery and have recertified. Every 10 years are recertified, and so far I've maintained both of those board certifications in ENT and plastic surgery. These are not that. These are our professional certifications in the specialty of plastic surgery. The American Society of Plastic Surgery, or the dual rings, that is a member specialty society. You apply, there's ethical review, and you need to be in the specialty and be board certified first before you can be invited to be a member of the ASPS. I'm definitely a proud member of the ASPS. That's our core plastic surgery professional society. And then I always knew that I would like to become a member of the American Society for Aesthetic Plastic Surgeons. The ASAPS is a subspecialty society. It is the specialty society within plastic surgery that deals exclusively with aesthetic plastic surgery. And most of our major meetings that I go to in some way are sanctioned or are related to the ASAPS, although I'm certainly very open to going to non-ASAPS meetings and meeting other specialists and how they do things. But at any rate, those have been important to me in my training. I don't think those are also direct requirements. That just is my background. It was important to me, and I'm proud of having gone through and done that. This has nothing to do with the surgery of the nose. This is
Another part of the body.
vaginal aesthetic surgery, vaginal rejuvenation, or vulvovaginal surgery. This is simply, I had an opportunity to work Dr. Red Allen's on a little preceptorship, and that's another specialty that I enjoy. But I believe in training, certification, getting your qualifications and credentials as part of it, so it's been very important to me.